Hello, this is Dr. David Green, CEO of the Ohio Pain Network. Today's topic is what you need to know about spinal cord stimulator implants. The spinal cord stimulator is a revolutionary device that is permanently implanted around the spinal cord in an effort to provide pain relief to those with chronic pain. The most modern ones work well for either chronic back or leg pain. It's considered a last resort treatment because it does involve a surgery. It's very expensive for the insurance companies. It doesn't fix the problem, but it can mask the pain. So if you're not a candidate for surgery, this can be a great treatment. Who benefits? Well, it's not a first-line treatment. It is a last resort. As mentioned, it doesn't fix the problem. It masks it, okay? It's an excellent last resort option for those who have failed back or neck surgery syndrome, post-laminectomy syndrome, postherpetic neuralgia, RSD or CRPS, diabetic or peripheral neuropathy, and some types of testicular, pelvic, or even abdominal pain. Well, what it can do is it can take a person who has chronic pain, depression, inability to work or do recreational activities. It can completely turn a person's life around. All right? It's been shown to work well for back, neck, arm, and or leg pain. You have to have a trial placed first and leave that in for about a week to make sure that it's going to work. That's a low-risk procedure. It gets taken out in the office. If that works, then a spinal cord stimulator final implant is an excellent last resort option, especially when surgery is not indicated. It can decrease the need for narcotics dramatically. So here are the steps. The first phase is a trial implant. It's placed percutaneously with the patient under sedation. You don't do general anesthesia because the pain doctor has to ask the patient some questions. There are two tiny leads placed around the spinal cord, and it's actually attached outside the skin, like you see here, to a battery pack and a programming unit. All right, so it's worn for 5 to 7 days. It's taken out then in the office. If a person is getting over 50% pain relief, that's considered a success. The person then goes on to have a psychological evaluation, which is required by the insurance companies before they will approve the final implant. How is the final implant placed? Well, it's completely under the skin. It takes about an hour. It consists of a large paddle lead for better coverage. I'll show you a picture of an actual one in a second. The doctor will make a small bony removal over the spine so they can put the large paddle underneath it. And then the leads are tunneled underneath the skin to a subcutaneous area where the battery is placed. And this battery also doubles as the programming unit. Okay, the new ones used to be non-rechargeable. They lasted for a few years. Now they can be recharged through the skin while a person is sleeping. So how well do they work? Well, first of all, you can see how small they are now. These are the size of these units in comparison to a quarter. Look how small they are. And this is what the paddle lead looks like that goes around the spinal cord. Look at all these silicone diodes. That's why you can get so many programming options. Okay, so there have been a few studies. One by St. Jude showed 84% of patients had life greatly improved. Another one showed 77% good to excellent pain relief. For diabetic neuropathy, 85% of patients experienced substantial sensation recovery, and over 75% experienced significant pain relief. Another study showed for RSD that spinal cord stimulators work very, very well for pain relief. What are the risks? Well, there are some risks. They're usually not fatal or really, really bad, but the device could stop working after a while. The leads themselves could migrate. It could be infection, bleeding, possibly some wound breakdown. Those might require a revision of the procedure or just some antibiotics or something like that. The top non-operative pain management in Ohio is through the Ohio Pain Network. There are several clinics participating, accepting over 50 insurances, and providing over 25 treatment options with the board-certified providers. Visit us online today at ohiopainnetwork.com and then call us for more information and scheduling at 888-466-9898. I'm Dr. David Green with the Ohio Pain Network. Your pain stops here.